right, good morning everyone. Good morning Queensland, and good morning to all of our Facebook Live followers as well. And we've got a few things to get through today. So first of all, in terms of our case numbers, we have 19,932 new cases, including 5,940 rat tests. It is my very sad duty today as Premier of Queensland to report that tragically there have been 11 people that have lost their life. Any death is, of course, a tragedy, and every day I'm reminded that this is someone's grandmother or grandfather or brother or sister or aunt or uncle. And I think we all need to keep that in mind, that although this is a health pandemic, there are loss of lives, and any loss is a tragedy. And I express my condolences on behalf of the state to the families of the loved ones who have lost their lives under such tragic circumstances. The Chief Health Officer will go through in more detail and will outline about the hospitals and the ICUs. We've done 41,293 tests in the last 24 hours. And we have reached the 1 million boosters. So well done Queensland, and remember, if you are due for your booster, you must come out and get it. Don't sit at home and think, I'll wait this one out. The booster is that added level of protection. We need to come out and get your booster when it is due. And 58% of the eligible population are due for their booster have had it. But, of course, there is still a big remainder there, so please go to your GP, go to your pharmacy, or come to one of our health clinics. And, of course, we need to keep getting our children vaccinated, so thank you to everyone who has had their children's vaccine. And my 3 nieces sent me a photo the other day. They all went and had their vaccine, and they were very proud. I think they got a lollipop for it as well. Can I also mention that yesterday I convened our Cabinet Budget Review Committee. Ministers came back in. Cabinet's not due to meet, of course, until next week. But we wanted to go through a number of issues. Of course, we'll be hitting that peak in the next couple of weeks. That's really important that our hospitals are prepared. We had a good summary of that, and I thank the Chief Health Officer and the Health Minister for giving us a briefing in relation to that. The Deputy Premier also and his department updated on our desire to get more rat tests. Of course, this is a global issue. Everyone's in search of this, but if you think about it, we have capacity here in this country to actually manufacture these rat tests. So, you know, I think it's we need to ask these companies to put forward their approvals and get them done quickly, because rather than searching the world to get them, we could actually be producing them here locally. So it's something I'd like to raise at National Cabinet tomorrow. Now, in good news, we have 91.65% have had at least one dose, and 88.82% are now double dosed as at the 17th of January, which means we made a decision yesterday as part of our COVID task force meeting, and we have decided to set a firm date for vaccinated people, international travellers, coming into Queensland. And we have set that date as 1 a.m. this Saturday. So if you have family or loved ones, I know a lot of people have sons and daughters overseas or have parents overseas or brothers and sisters, this gives certainty to the airlines, it gives certainty to incoming travellers that from 1 a.m. on Saturday, you can come into Queensland and you will no longer have to do, if you are vaccinated, you will not have to do quarantine. You are free to come in. We're asking you to do a rat test within 24 hours. This is consistent with other states. If National Cabinet decides to change that down the track, so be it. But we do believe that now is the right time with our vaccination rates so high, 88.82. We want to give some certainty to the industry and certainty for people who are travelling. Can I just say something about with this, with our international, of course people will come into all different parts of Queensland, but I just want to make this observation. over the past week, I've had a look at our regions and our vaccination rates. Now, people are going to be coming into Brisbane, the Gold Coast and Cairns. Brisbane is around 93 to 95% vaccinated. That's fantastic. Cairns is at 94.1% first dose. And sorry, I should add, some parts of Brisbane are over 95%, such as Brisbane East. The Gold Coast, however, and I know I keep talking about the Gold Coast, but I am concerned, the Gold Coast is still sitting at 90.5%. Now, to put that in perspective, we were very concerned at the start of this vaccination campaign about Mackay and Central Queensland. Mackay is now more than 90%, Townsville's 91.7%, South West Queensland's 93% first dose, and Darling Downs region is 95%. So if you look at the scheme of things, in terms of where people are going to be travelling, can I please give an added push for the Gold Coast region? Please come and get vaccinated. If you are due your booster, come and get your booster. If you are unvaccinated, now is the time to get vaccinated, and the Chief Health Officer will have more to say about that. So I'll hand over to the Chief Health Officer and then the Health Minister. Thank you.
So sadly today we have 11 deaths to report from COVID-19 in Queensland. One person in their 30s, one in their 50s, two in their 60s, one in their 70s, three in their 80s, and three in their 90s. And our thoughts are very much with their family and friends. Of these people, two of them had not been vaccinated, 7 were double dosed, and 2 had received boosters. These last 2 who had received the boosters were from residential aged care facilities and had very significant other medical problems. The person in their 30s was not vaccinated. Now, we now have a total of 835 people in hospital with COVID-19. That's up from yesterday, from 819. I mentioned before that Monday there's often a slight overrepresentation after the weekend, so that's corrected itself somewhat, but it's clear that the numbers of cases in Queensland hospitals continues to rise, as we have always expected, as we head towards the end of the month. So the 835 people in hospital includes 52 patients in ICU, 18 of whom are ventilated. And yesterday, you might recall, there were 50, so that's a slight increase. So the next 3 weeks or so are going to be a very tough time for Queenslanders and also specifically for our healthcare workers in Queensland hospitals. Thank you very much. I'll hand it over to the Minister.
I'd also like to just reflect my condolences to the families of these 11 people who have lost their lives due to COVID. As the Premier said, any loss of life is sad, but we do say to people that we do know the vaccines make a difference, and we strongly encourage people to come forward and get vaccinated. And if you're eligible, come forward and get your booster. Thank you to all the parents who are coming out and getting their young ones vaccinated. The numbers going up each day. It's really impressive to know that we're now 16.39% of 5 to 11-year-olds is fantastic, and to know that we've now had over 1 million Queenslanders get their booster. That is wonderful. So please keep coming out. Make bookings in your pharmacies, your GPs, and you can also go to the state vaccination centres. You can book in, but you can also walk into those vaccination centres. We had 400,000 rapid antigen tests arrive yesterday in Queensland. 100,000 of those are the ones promised by the Commonwealth. Half of those are point-of-care tests, so we'll be using those within the health system, and 50,000 are self-assessment kits, so we'll be able to provide those at our testing clinics. But of course, we know that demand is going to outstrip that supply in the current environment. We are expecting more again this week, but we don't assume anything. We have to wait for those supplies to come, because we are hearing right across the country that no matter what your orders are, the number of deliveries are not necessarily matching what you're expecting. So I am pleased we got these today. They are going to be critically important as well. And just continue to encourage people to look out for symptoms. Please stay home if you are unwell. It is really important that you don't go to work or you don't move around the community while you're unwell. Make sure that you are watching for symptoms and either acquiring a rapid antigen test if you can get one, or you can still go to one of our clinics for a PCR test if you are unwell as well. And of course at some of those clinics we'll have tests that we can hand out for people to take away and test at home as well.
Premier, just with that rapid antigen testing for overseas arrivals, is that when they arrive, they go home, you just want to obviously get some clarity?
Just look, it's a precautionary measure in terms of if they've come in and they're positive, then they should go see a local doctor. They'll have family with them or friends. Yeah, it's precautionary. They're probably more likely to catch the virus in Australia at the moment, but it's a precautionary. It's consistent with the other states, and if at some stage National Cabinet moves, we're happy to move with that.
And just on that, the Prime Minister did a stand-up this morning, and it's a bit conflicting, it's a bit confusing in stages. Basically what he said was that he said during National Cabinet that he would provide rapid antigen tests for the aged care sector, being that it was the federal aged care sector. Then he said that it's up to the states to provide their people with rapid antigen tests. They should have been making these orders. Can you clarify what the actual...
I thought we're all in this together, so I think there needs to be continued cooperation between the state and the Commonwealth. Of course, the Commonwealth has much larger purchasing power than the states. You've seen in other countries where national governments are responsible for actually purchasing the rapid antigen tests. I just think we've all got to cooperate here and do as much as we can to get as many RAT tests in the country. And that's why I'm calling on, domestic manufacturers, if they can produce them domestically, let's try and get them accredited quickly and produce some of these tests here in Australia.
With the international borders opening quarantine-free, have you alerted the airlines to this decision prior to now? Any indication about when we might start to see an increase in international flights arriving?
My Chief of Staff was contacting them just before I walked out here.
Do you have a message to them? Obviously, we've been open for business, but do you encourage them now to start that flow of international travel into Queensland?
Oh, look, they'll make up their own minds. The whole world's going through this pandemic, but I think everybody knows someone who has a friend or a relative overseas, and some people have not seen each other for a couple of years. So it's a time for families to reunite. The fact that we are going through a wave at the moment, it's up to families to work out when they travel. Some people have delayed their travels, but I think it actually now allows some certainty for people to be able to book their airline tickets, and also to knowing that they don't have to, if you're fully vaccinated, you don't have to quarantine. If you are unvaccinated, of course, there will be mandatory quarantine.
It sounds like it's...
in the tourism sector that who are struggling with staff shortages due to all the isolation rules. Why don't you just stretch them even further?
I don't think so, because I had looked at the numbers of the airline numbers coming in. It's actually not great at the moment, so there aren't a lot of people travelling. Remembering we're going to reach our peak in the next couple of weeks, I think this is good for forward planning. So people might think, in a couple of months' time, I might go and visit some relatives, or in a couple of months' time, I'm going to come and fly into Queensland and visit mum and dad or my grandparents who I haven't seen for years.
Airline staff, Premier, is that announcement, will they be in line with this as well?
They will. The Health Minister will address that in a moment.
When do you think we might more actively pitch the international holiday makers? It sounds like you're encouraging people to visit family and limited travel.
Yeah.
When do you think we might be advertising overseas that people should...
Well, of course, Queensland's a very attractive international market, and I think we've shown that during the first 2 years of this pandemic, the desirability of people to come to Queensland, and I just think we'll get through this this wave, and hopefully it'll encourage people to not just travel around domestically around Australia, but also go overseas. Yep. But let's get through this wave first, okay?
And what date will Wellcamp open?
The Deputy Premier is working on that.
Can I tick up also a couple of questions?
Yeah, sure, Tim. Yep.
Yesterday, Dr. Giro, you were talking about the projections of hospitalisations being in the thousands. Is there any projections that have been done about the number of health workers who may be off when we hit that Omicron peak?
No, I haven't actually seen any projections, I'm afraid. No, I don't know that.
And then yesterday, there was talk about 6,000 Queensland health workers are currently off either on close contacts or as sick with COVID.
Yep.
Is there any breakdown on those numbers as to how many are close contacts and how many have COVID?
Yeah. Okay, I'll leave that to the... I think I have a bit, but leave it to the Minister to answer that question, yes?
Yeah, sure. And lastly, we were told by a nurse who currently has COVID, she's been told by her supervisors that she no longer needs a negative test to come back to work, she just has to be asymptomatic for 2 days. Is that the policy across Queensland Health now?
Well, someone who is positive, they are released from isolation after 7 days.
Yes.
That's standard.
Yeah, so they don't need a negative test to come back to work, that's the standard?
No, that's standard.
Yeah.
You mentioned a 30-year-old.
Sorry.
You mentioned a 30-year-old who was unvaccinated.
Yep.
I appreciate you can't go too in depth into the medical history, but were there any underlying health issues there?
I actually don't have those details. I don't, so.
Minister, can we just ask about, there's some reports today obviously about a young disabled gentleman from Redcliffe. I'm sure you're well across it.
Yeah.
Can we just get some comments, please?
Yeah, look, firstly, my condolences to that family. Very sad situation of that young man. Look, I know that that young man suffered from a lot of underlying health conditions, but as far as his cause of death, I wouldn't comment. It has been referred to the coroner, and the coroner will investigate all that. I am aware that he did subsequently test positive after he was deceased, and all of that will be considered. The Hospital and Health Service has reached out to the mother and is offering support to her as well. It's a really difficult time, and we'll wait to see what the coroner's report says. On the issue of airline crew, yes, we have already made a decision that airline crew will bring ourselves into line with how international airline crew are being managed elsewhere around Australia. We were contacting airlines yesterday to advise them that staff, or international airline crew who are fully vaccinated, will be able to arrive and not have to quarantine immediately, so we won't wait till Saturday for them, as long as they, again, do a test on arrival, which is consistent with other jurisdictions, and that comes back negative. They will be able to move around. When it comes to unvaccinated, which I would think there'd be very few airline crew, but if there are, some of the smaller airlines, that they will still have to quarantine as well. On the issue of the health workers and those who are positive, it's not just a health policy, it is a national guideline as far as you only need to quarantine for 7 days if you have tested positive, and you don't need to have a negative test at the end. And this is the issue that the Prime Minister also talked about, where there's employers insisting that if you've been positive, you have to show the employer a negative test before they let you come back to work. I know that was discussed at National Cabinet a week or so ago, and the Attorneys General are looking at that. But health worker or not, anyone in the community who tests positive, 7 days after that, if they are asymptomatic, they can leave isolation. So those are the current rules. Now, as far as the number of staff that we have quarantining and who are positive, so we have a total of 6,048 across the Hospital and Health Service as well as Queensland Ambulance Service. Of those, 2,766 are positive, and 3,282 of them are quarantining as close contacts. Many of them are positive and close contacts as a consequence of contracting this in the community or living with someone else who's been positive and they've subsequently contracted it. 183 of those staff have been asked who are close contacts to come back and work in certain settings in the health system. So only 183 have been called back so far.
Do you think the number will increase, the 183, do you see more Omicron cases?
Yeah, look, as the demand and pressures on the health system, this is part of our escalation plan. The one thing, we certainly modelled a percentage of our workforce getting infected and being offline. That was part of our modelling, as well as our bed capacity as to how to manage and when we escalate through the levels. This level, I think globally we're seeing, and the airlines as far as number of international flights, it's not so much about quarantine requirements in countries, it's more about there is a global shortage of airline crew right now because they're positive and close contacts, and we're seeing flights in the US cancelled every single day because of that. So, yeah, all of those issues are taken into account, but we are seeing much greater numbers than any of us could have predicted because of Omicron. In a shorter time span. So we're working with that. That's why we've brought not just beds online in the private sector, but that the private hospitals are providing staff as well, so we're not having to supplement them with public health staff.
Minister, have there been...
Yep. Law's family has lodged a formal complaint with the hospital. Will you be investigating the matter?
I don't personally investigate these matters. They are clinically reviewed internally and they're subject to a coronial consideration. So that's where it should be. The experts will look at this, and I'm sure the coroner will, release a report in due time and any findings or recommendations. And of course, if there's any recommendations about things to improve, but let's find out the facts of this situation. It's a very complex, from what I have been briefed so far, it's quite a complex situation.
Are you concerned by comments from the family that they were denied a rapid antigen test?
Again, I just want to find out all the circumstances. I've got a brief at the moment, but I'm not going to give a medical opinion on that brief. I'll leave it to the coroner to do their investigation and hand down any report.
Can I just ask, again on this rapid antigen test and the overseas arrivals, are we not putting a little bit too much pressure back on ourselves now, considering that the borders are open so anybody could come in? And the other thing is, how will we police that if that's the health directive? Will you be saying, so Johnny Smith arrives, you check his passport, police will go to his house, or is it an system?
It's just we're asking people to please do that just to check if they are testing positive.
Is it to maybe find a discovery of another strain? Is that why you put that direction in?
Well, if you're positive, you should go and see your doctor or isolate at home. So it's just about an added protection to the community. I'm not too concerned about it. Like I said, there's more virus circulating in Australia at the moment than there would be on a plane load coming in from a different country. But we don't know what's going to happen in the future, so we'll wait and see.
What impact do you think this will have on case numbers, though, now that we've got
I don't think it'll have a big impact on case numbers, Jack, at all. No, I can't see that. No, yeah. And also too, can I also add too, now that we're so close to that 90% and we are allowing vaccinated people not to quarantine, this gives added certainty as well for our business community. A lot of business people have been wanting to travel overseas for various things, and likewise, people coming here. This gives them added certainty as well now to be able to freely book to go overseas and come back and not have to do the 14 days. Having done the 14 days, can I say, I think a lot of people will be very happy that they won't have to do it.
On QI, I was asked the Health Minister
yesterday.
Yeah. Obviously still in place for the time being.
Yeah.
What is the milestone that we're looking to reach before that would be allowed back? The need to check in?
Look, at the moment, people need to check in to show that they are vaccinated, okay? So this is really important. The vaccination rates are being driven up in Queensland, which is fantastic. Can I thank everyone for coming out and doing that? But of course, it is still needed to make sure that people know they're going into a place and everyone in that place, that restaurant or cafe or bar or nightclub, is vaccinated.
You can still show us the element of it. Is that still
Sorry?
The contact tracing element in terms of just registering?
My understanding is that's being utilised if there is a large outbreak, so people do know. Yeah.
Would you concede just at the moment with the foot traffic in the Queen Street malls down by 50%, business are still struggling? Would you concede that that's the case in Queensland at the moment?
Well, it depends where you are. If you are on the Sunshine Coast or the Gold Coast or Cairns or coastal communities or holiday destinations, they tend to be experiencing a bit of a higher volume in trade or a steady trade. Yes, I think the city is experiencing a bit of a downturn at the moment. Don't forget, there are still people who are either on holidays or working from home. So we will be monitoring that situation.
With this decision today, what's the point of the health camp? Is it just going to sit empty there?
No, it's not. The Deputy Premier will be making announcements about that shortly.
Premier, would you support calls from the unions to send the ADF in to help basically overwhelm aged care
Look, I am concerned about aged care at the moment. It's a federal responsibility, and if they want to send in additional resources, I understand that the health minister said yesterday they were sending in additional PPE, which is fantastic, but it's really important that people get their boosters. So I think the priority needs to be aged care, so the federal government needs to get the aged care residents and staff boosted. We're calling out people to, if you're due to get your booster shot, to come out and get boosted. If you are a family and have children in that younger age cohort, please come out and get them vaccinated as well. If anyone has any concerns, please do not listen to social media about not getting vaccinated. Go and speak to a respected health professional, because I don't want to see unvaccinated people end up very sick in hospital. So I think we've given the opportunity for every single Queenslander in this state to get vaccinated. No one can say that they have not been given the opportunity to be vaccinated. So now the onus is on you if you haven't, but if you're due your booster, please get your booster. It is so critical to have that added layer of protection when it is due. Okay?
This is about hospital visits, if you can answer a quick question about...
yeah, this is the last one. Yep.
From the private sector is about when that rule will start. Was there any consultation with private hospitals before the announcement of that new rule yesterday? And the website still, the Queensland Health website still says you can have as many visitors as you like. When does the rule
Yeah, look, the Public Health Directive is still to be issued, so it will formally take effect when the Public Health Directive is released. The draft was there yesterday, so I suspect that it'll be hopefully today that Public Health Directive can go up online, and that will then apply to all of the public and private. I think from a public perspective, yeah, at a local level, they're implementing that very quickly. You know, we have to act quickly on these things and act on the advice that we've been getting, which is that, you know, there's large numbers, particularly in EDs. This is less of a problem for the private sector, but in EDs, and that we need to reduce the number of people coming in. So, you know, I would hope that the private sector understands why we're doing this. In fact, from some consumer groups, they thought we were going to go to zero, so they're welcoming that we're still allowing visitors in. And we've done that because we took the advice and feedback we had of what has happened in previous lockdowns and the distress it causes with not letting anyone go in. So we're just trying to find that middle ground. I have no doubt. I've had no calls from any of the private hospitals saying that they're concerned about this announcement at all. Thank you.
That's it,